Hello, my name is Dr Owen Carter. I'm a GP and also the RM Partners Cancer Alliance Clinical Director for Primary Care in South West London. I co-authored the best practice guidance for primary care on cervical screening in trans men and non-binary people with my colleague Dr Charlotte Verney, who's a GP trainee at Lavender Hill Group Practice in Battersea. We collaborated with patients who have lived experience of screening, gender identity service clinicians, NHS Digital, and charities including the LGBT Switchboard, and lived through this. We produced this guidance as we know the National Cervical Screening Programme is highly effective, and it's estimated that between 1988 and 2013, 65,000 cases of cervical cancer were prevented in the UK because of screening. However, we know that there can be barriers to accessing cervical screening for some trans men and non-binary people with a cervix. This might include if you feel your doctor is not confident when managing your care, how your data is coded in our system, and how we provide any additional support. If you're a trans man or a non-binary person born with a cervix who is no longer registered as female with your GP, then you will currently not receive an invitation to the National Cervical Screening Programme. At the moment, our system requires trans men and non-binary people to actively request and push for their screening appointment, and this is by no means ideal. There's a new update in development from NHS Digital that potentially allows GPs to add trans and non-binary people to the system so that they can benefit from the automatic screening invitations and reminders. However, as there is no set launch date for this yet, primary care teams need support on how to code trans and non-binary patients into their system and encourage uptake of cervical screening. The guidance we produced has been designed to address this. It provides an efficient and robust way to identify trans and non-binary patients who need cervical screening. This helps us to invite and support those patients through the National Cervical Screening Programme. I believe that providing equity of care should positively impact patients who otherwise miss the opportunity to undergo potentially life-saving cervical screening. This supports our goal in primary care to improve screening and early diagnosis of cancer and tackle inequalities. If you or your GP would like to access this guidance, it can be found completely free of charge on the RM Partners website at rmpartners.nhs.uk in the Publications and Resources section.